Okay, well, hello everyone. I'm Paris Benora, and I'm excited to welcome you to today's webinar, Honoring Veterans at HHS and Exploring Career Paths in Science and Medicine. It's especially meaningful to gather soon after Veterans Day, a time to reflect on the incredible contributions of veterans. Today, we're here to celebrate the unique roles veterans play at HHS and inspire those considering federal career by showing you how your skills and experiences can lead to impactful opportunities. Let's begin with an overview of HHS and our commitment to supporting veterans transitioning into federal service. As I mentioned, I'm Paris Benora, and I'm honored to serve as the Veteran Employment Program Officer at HHS. I'm thrilled to introduce my colleague, Drew Sullivan, who has been instrumental in bringing this event to life, handling marketing, social media, and event promotion. Together, we're excited to highlight how HHS offers meaningful opportunities for veterans and to contribute to improving the health and well-being across the nation. Today's agenda is packed with valuable insights. We'll explore HHS's mission, key job series in science and medicine, and hear from our incredible panelists. We'll also save time for your questions during an open Q&A session. By the end, we aim to leave you informed, inspired, and ready to take on your next career steps. HHS's mission is to enhance the health and well-being of all Americans through essential services and advancing medical science. HHS impacts nearly every aspect of life, from vaccines to food safety to healthcare. Veterans play a vital role in this mission, bringing discipline, leadership, and problem-solving skills from their service to tackle complex health challenges. Shortly, you'll hear inspiring stories from veterans who've made meaningful impacts here at HHS. HHS includes 13 operating divisions, each with specific missions to enhance America's health and well-being. For example, the CDC focuses on public health and disease prevention. The FDA ensures safety of food and medical products, and the NIH leads to medical research and innovation. These divisions and others offer unique career paths for veterans in areas like public health policy, regulatory science, and medical research. Think about how your skills might align with these opportunities as we continue. Beyond the operating divisions, HHS has 16 staff divisions that support our mission by providing essential functions in administration, legal guidance, and public health coordination. Some prominent staff divisions include the Office of Assistant Secretary for Health, OASH, which oversees public health policies, and the Office of Inspector General, OIG, which ensures accountability and transparency. For veterans, these staff divisions offer diverse career opportunities in administration, public affairs, and health policy, areas where military training and leadership skills are a great match. Additionally, I want to mention the U.S. Public Health Service Commission Corps, which is made up of public health professionals who respond to health emergencies and promote health initiatives across the nation. Okay, the 601 Job Series or General Health Science is perfect for those passionate about improving health outcomes and shaping public health policy. A degree in a related field like biology or public health is typically required. No specific licenses are needed, just a commitment to research, data management, and collaboration. Think of it as a role where you're not just analyzing health data, but using it to drive real world impact. One of my favorite examples is a team at NIH who turned community health data into programs that reduce diabetes rates in underserved areas. Next slide. Veterans preference applies within the competitive hiring process for the 0601 series, giving eligible veterans priority in hiring. This series offers diverse career paths in public health, program management, and health science research, with opportunities for advancement into leadership roles at agencies like CDC, NIH, and FDA. If you're interested in applying, remember that USA.jobs.gov is the primary platform for all federal applications. Now, the 0602 job series or medical officer series focuses on direct patient care and medical leadership. If you're an MD or a DO, this is where your clinical skills meet public health policy. Beyond patient care, you'll contribute to research and policy development. A fun fact, the FDA employs over 2,000 medical officers who are essential in ensuring the safety and effectiveness of medicines we use daily. These professionals conduct rigorous evaluations and ongoing monitoring to public health. Their work directly impacts millions of lives, making them vital guardians of our health. Veterans in this series bring unique discipline and problem-solving mindset in their service, which is highly valued here. Key responsibilities include providing comprehensive medical care, conducting research, and collaborating with other healthcare professionals to improve patient outcomes and support public health initiatives. Medical officer positions are available at several HHS agencies, including the CDC, NIH, and FDA. It's important to note that when hiring under direct hire authority, veterans preference does not apply, allowing agencies to hire quickly for high demand roles. This series also offers career advancement into specialized medical fields and leadership roles such as Chief Medical Officer. For details on qualification standards, you can visit the OPM Medical Officer Series page. As a reminder, to apply for a position with HHS or any federal agency, you'll need to use usajobs.gov. This platform manages the entire federal application process from submission to potential interviews. For veterans, there are additional hiring paths, including the Veteran Recruitment Appointment and the Veteran Employment Opportunities Act, which provide veterans with additional opportunities to secure federal positions. Now, I'm thrilled to introduce our panel moderator, James L. Egbert. James serves as the Director of Human Capital Planning and Analytics here at the Department of Health and Human Services in Washington, D.C. Driven by HHS's mission to enhance the health and well-being of Americans, James has led the design and implementation of innovative workforce strategies that have greatly strengthened our human capital systems. His work has been key to HHS earning repeated recognition as one of the best places to work in the federal government. Before joining HHS, James was the director of training and development at a major U.S. healthcare company and served over 20 years on active duty in the U.S. Air Force, holding roles in career coaching and organizational development. James's academic background includes Associate of Applied Science in Aerospace Technology, a Bachelor in Psychology, and a Master's in Human Sciences, foundations for his deep expertise in human capital management. Please join me in welcoming James as he leads us into the next part of our program.
Thank you, Paris. And thank you, everyone, for coming together today. I'm quite excited to hear from our panel of experts. I'll be your moderator. We have some prepared questions that we will go through, about a half a dozen or so. We'll give an opportunity for each of our three panelists to respond. And we have 2 hours allocated for this. We may go the full 2 hours, certainly probably go at least maybe 90 minutes or so. So we'll leave a good amount of time for questions that you can enter into the question and answer element there on your screen. So we'll be monitoring those. So again, it's a pleasure to be here, and let me give an overview of biographics of our panelists. First up, we have Dr. Tom Berklow. Tom is the Director of Education and Training at the National Institutes of Health Clinical Center. As the director, he oversees a portfolio of training and educational programs to include continuing medical education activities, graduate medical education, the healthcare simulation training program, and undergraduate medical student research training programs such as the Medical Research Scholars Program. Tom joined the National Institute of Health Clinical Center in 2017 after a 30-year career in Army medicine, where he served as the Chief of Pediatrics for 10 years at the Walter Reed Army Medical Center and subsequently the Walter Reed National Military Medical Center, then as Director of Healthcare Operations. His military deployments include those in support of Operation Desert Storm and Desert Shield, Iraqi Freedom, and is a recipient of the Legion of Merit with 1 Oak Leaf Cluster and the Bronze Star Medal. Tom attended college at Washington University in St. Louis on an Army ROTC scholarship, and he subsequently graduated from the Washington University School of Medicine. He completed his pediatrics residency at Walter Reed Army Medical Center and a fellowship in pediatric cardiology fellowship at Children's National Medical Center, Washington, D.C. Board certified in general pediatrics and pediatrics cardiology, and as a pediatric cardiologist, he remains clinically active with a joint appointment as chief of pediatric cardiology section of the National Heart, Blood, and Lung Institute as cardiologist consultative services. Thank you, Tom, for taking the time out to join us today.
Thank you, James, and thank you, Paris.
Yes, thank you, Tom. Also, I would like to introduce Dr. Mariam Din Atali as the Chief Medical Officer in the Division of Pediatrics and Maternal Health at the United States Department of Food and Drug Administration, FDA, in Maryland. As the Chief Medical Officer of the Maternal Health Team, she oversees quality initiatives that improve pregnancy and lactation-related information in prescription medication labeling and advanced research in pregnancy and lactation. So as the Chief Medical Officer for the Maternal Health Team, she oversees quite a bit there as well. Marian began working at the FDA as a medical officer in 2013. She received her Bachelor of Science degree in biology from Delphi University in Garden City, New York in 2002, and her doctorate of osteopathic degree from the New York Institute of Technology College of Osteopathic Medicine in 2006. She completed her residency training at the Family Medical Center, Malcolm Grove Medical Center, Joint Base Andrews in Maryland, 2009. She's board certified in family medicine. She served as a family medicine physician and officer of the United States Air Force from 2006 to 2013. And in November 2013, she entered U.S. Public Health Service as a commissioned officer. She remains clinically active, practicing family medicine part-time at the Arlington Free Clinic in Arlington, Virginia. Welcome, Mariam.
Hey, thank you so much.
And we also are joined by Major John Sandam. He is a member of the Division of Global Health Protection, Global Health Center, U.S. Centers for Disease Control and Prevention, and the United States Army Reserves. He has served as a citizen service member for the past 20 plus years and is currently a global health emergency responder at the Centers for Disease Control and Prevention and a senior medical advisor with the U.S. Army. John received his PhD in health sciences from Nova Southeastern University He also earned a clinical laboratory specialization in medical technology from the George Washington University. He has served in multiple global health security roles while deployed on behalf of the Centers for Disease Control and Prevention and the U.S. Army to North America, Europe, Africa, Asia, and the Middle East. He is currently deployed as a service member with the Department of Defense, Office of the Surgeon General, United States African Command, supporting security operations with African partners in collaboration with the Department of Defense, the U.S. Agency International Development, the Department of State, and HHS. After his deployment with the Department of Defense, John will return back to CDC. So welcome, John.
Thanks, Jim. Appreciate it.
All right. Well, let's get right into some questions. And so how we're going to do this is we'll ask a question. I will provide a few minutes for each of our panelists to respond. And again, please make note of any questions you want to ask toward the latter half or so of this session. So let's go ahead and get started with the first question. And Tom, we'll go ahead and start with you, okay? So what inspired you to pursue a medical career at Health and Human Services? And what were some of the key challenges you faced during this transition?
Well, thank you, Jim. And before I get started, I do want to thank HHS, the Veteran Employment Program, and the Office of Human Resources for inviting me and all of us actually to be able to share our experiences and thought reflections. I greatly valued my military career, but I equally valued my career that I'm now having here at the NIH. So as far as the Army, I think when you think back on it, and I think a lot of folks who've been in Army say that what they really remember most fondly is really the people that that I worked with. And so I was obviously seeking another environment where, developing camaraderie and partnerships, both professional and personal, were important to me. And I think the other thing that really drove my desire to join the HHS and NIH was being part of the Army. I always enjoyed being part of something that's bigger than myself. And I think the same thing applies here. And so to be part of, institutions that's actually looking out for the well-being of, the American public, and that means a lot to me. I focus on patient care without concern to insurance or cost to the patients, and that's something that a similarity between Army medicine as well as here at the NIH. Professionally, I was wanting to remain engaged with clinical training. One of my experiences in medicine in the Army was always work with medical students and residents, and so I can continue to do that in my current role. I think the biggest challenge I had, I suppose, was the bureaucracy. I naively thinking that all bureaucracies are the same, and then I realized that, and I was rather facile about military medicine bureaucracy, but that doesn't necessarily prepare you for other bureaucracies. But once I figured out the commonality is that there's an answer somewhere in some rule or regulation. So, but that's something that I could get through. So, yeah.
Thank you, Tom. Miriam?
Yes, again, thank you again. I'm really excited to be here and share my story with everybody. So I spent about 7 years working as a family medicine physician in the U.S. Air Force. And although I really enjoyed seeing patients in clinic, I felt like something was missing. Like I wanted to make a bigger impact on the public health of the nation. So one of the providers that I worked with in clinic said that he had a friend who worked at the FDA in the area of pediatrics and maternal health. So I became interested, wanted to learn a little bit more about the work that she was doing. So I reached out to her, spoke to her by phone, and I learned that she was also a family medicine physician. She had served in the Air Force and had transitioned to the U.S. Public Health Service as a medical officer, now working at FDA. So I was intrigued by the work that she was doing at FDA to ensure that children and pregnant and lactating individuals had safe medications. And I was also intrigued by the mission of the Division of Pediatrics and Maternal Health, which at the time was known as Pediatric and Maternal Health Staff. So after I spoke with this medical officer, I did a little bit more research into the FDA, and I decided that this is where I wanted to be. So I shared my CV with her. I was offered an interview at FDA in June of 2013. And within a week after my interview, I was offered a position as a medical officer. The summer of and fall of 2013 was filled with many transitions. I was honorably discharged from the Air Force in June. I gave birth to my first son in July. I began my journey at FDA in September as a medical officer within the pediatric and maternal health staff. And then in addition to transitioning to a new job at FDA, I was also in the process of transitioning to the US Public Health Service. So within 2 months of starting as a civilian at FDA, I began my 2-week officer training for the US Public Health Service on November 30th of 2013. So by mid-December of that year, I was back in uniform as a lieutenant commander in the US Public Health Service. So 2013, as you can imagine, was a challenging time. I was learning a new job as a medical officer at FDA, but I was also learning about my new uniform service, the USPHS.
Thank you. Thank you, Miriam. John.
Yeah, thanks, Jim. I think what the biggest thing that inspired me to pursue a career at HHS, particularly with the CDC, is it was 2009, 2010. I was a young lieutenant working in Iraq, serving as a medical service officer, working on environmental health. And I realized the challenges of potentially continuing to have to deploy and what I would have to do as a reservist and for full-time work. And I saw an opportunity working at the CDC and knew that I'd be supported and protected working at a federal agency, particularly under HHS, that as a reserve member, I could work full-time and as called upon by the Department of Defense. If I was deployed, I would be protected, my job would be secure. And I found a lot of value in that, a lot of safety, a lot of security. And, you know, here we are 15 years later. I've served 22 years in the Army, 15 years at CDC, and you can do both. And I'm a good use case in that. And I like to highlight that right now I'm still reserves, but I'm actually mobilized reserves serving overseas and still part of the CDC. And that's what I value the most, is I can give back to my country and provide that support, provide my medical expertise to where it's most needed, rather deploying on behalf of the Department of Defense as a mobilized reservist or as CDC, which I have done multiple deployments, and sometimes the military has taken a backseat. So it just depends on what's going on in the world, what humanitarian crisis, what disease outbreak, and where the most need is. So I find the most inspiration is being able to maintain both careers while working at CDC. Thanks, Jim.
Thank you, John. So, you know, as we sort of took a look at this question here, what inspired you to pursue a medical career at HHS? What are some of the key challenges you faced in the transition? You know, I heard, you know, to make a bigger impact, to be the place that I want to be, to be able to maintain a role of military and HHS and to be able to give back. I know, you know, part of the intent with holding this session today is to, as Paris said, was to inform and to inspire and perhaps even to have you consider a career in federal service and public health, maybe here at HHS. So maybe back to the panelists for a second in terms of bigger impact, place I want to be, a place to give back. Any other closing comments for that particular question, either from Tom or John or Miriam? Anyone?
I think you captured it well. You know, I think for me, you know, I feel like the sense of service is deeply embedded in my DNA, and to be able to do that in a way that I feel like I'm serving, giving back, and you know, is extraordinarily important to me. And it's not about profit margins or the bottom line. It's really about, you know, how can I improve care? How can I support research? How can I help train the next generation of physicians and physician scientists? Means a lot to me. So, and I see those as my metrics of success. So.
Nice, guys.
Yeah, thank you, Jim, for that. I definitely agree. I mean, to me, it's very important. I mean, I was seeing one patient at a time. You make a little bit of impact, here or there, but just to have that bigger impact. I mean, the area I'm working right now is maternal health, pregnancy, and lactation. It's just, such a brand new area where there's so much more that we can do. And it's just, I'm really happy and honored to be in a position where I can make a difference for the whole country.
Yeah, and just like to echo what Tom and Miriam just said, basically a lot of the work that we get to do is humanitarian work, and it's so special, so unique. It's hard to describe, and it's a thankless job. A lot of individuals they hear about it in the news, like there's individuals working on Ebola, or there's individuals working on polio, or these type of disease outbreaks, but they may not know the person that's actually being the team leader, or the epidemiologist, or the pediatric doctor that's forward, or just who's the face that's actually supporting these. And that's what I'm just amazed on, is just some of the activities and efforts that we get to support on behalf of HHS, on behalf of the U.S. government, working with colleagues with the World Health Organization, working with some of the implementation partners, international non-governmental organizations, working with the militaries to help provide logistics and supplies and support. I like to use Liberia as a good example. The Public Health Service Corps set up a Ebola treatment unit, and world class. Some of the best care you can imagine was being done right there in Liberia, right off the capital of Monrovia. The U.S. Army working together with the U.S. Centers for Disease Control, NIH, FDA, on how do we increase access to vaccine? How do we mitigate the spread of the virus? How do we do laboratory diagnostics? All working hand in hand. Is just something that you read about in the history books or Time magazine. But as HHS employees, as CDC employees, we were there. We got to do that, and we experienced that, and we take that experience and we get to use that for other outbreaks and other humanitarian assistance moving forward. So good question, Jim. Thank you.
Oh, absolutely. Here we have the opportunity to talk with three of about 90,000 HHS employees serving in all kinds of different occupations. We're a bit focused here on the medical today, but serving in all kinds of occupations all over the world. So just a wonderful opportunity for someone that's looking for a way in which to have a bigger impact, to serve and find your place to be. So thank you for that. Let's go ahead and move on to the next question. How has your military background influenced your approach to your medical career at HHS? And what unique skills or values have you brought to your role? And I'm going to go ahead and start with John. John, you want to answer that question from your perspective?
So I have to say, Jim, my military background has set, for me, myself, every individual is different, but in my career trajectory and path, I'd say 10 to 15 years ahead of my peers. And I say that in a meaningful way, just some of the leadership positions I've been given and just the experiences I gained firsthand in the military. I was able to bring that to the CDC, and not that I have all the answers or is the necessarily expert, but just being able to just some of the core military skill sets that we learned, just the operation side, the planning side, a lot of the pieces that as scientists, we know the science, but we don't know how to get to the answer, or the logistics behind that. I think that's a flavor that I was able to help bring to the table along with my technical. So I pride myself as being let's say 50% technical and 50% program or planning ops, and be able to navigate and coordinate and be an agile. And I think the military has really taught that and brought that skill set that I wouldn't have otherwise. And it's really kind of propelled me forward within my career at HHS. Thanks, Jim.
Absolutely. Absolutely. Miriam.
Yes. Yeah. Thank you for that question. Yeah, I'll share some of my experiences. So I was part of the Health Professions Scholarship Program, began my residency in family medicine at Joint Base Andrews. So after 3 years of residency, I spent a year working in the emergency room at Osan Air Base in South Korea. You can imagine this is a difficult transition. Here I was, brand new family medicine physician, mostly working in the clinic setting, but now put into an emergency room setting. So I quickly had to learn how to deal with urgent and emergent situations, how to lead a team of nurses and technicians in the care of patients. I served as a preceptor, oversaw medical training for independent duty medical technicians. I served as an ACLS instructor during that 1 year in Korea. In my free time, I helped to augment the women's health clinic there, so our patients were receiving prenatal care. After I finished my time in Korea, I finished up my last 3 years as a family medicine doctor at Andrews Air Force Base. And there I led a primary care team of technicians, a nurse, a physician's assistant, and we cared for over 2,500 patients together. So during this time in the Air Force, I learned time management. I learned how to refine my communication skills. I learned how to network with others. I learned how to lead others. And these are all the skills that really have served me well as I transitioned first to the position of medical officer and now as a team leader at FDA. So definitely skills that I truly value and thank my military training for what I have now.
Thank you. Tom.
So, John and Miriam captured, I think, the primary themes, and I don't have much to add to that, but I got to say something, right? So currently, my scope of responsibility falls into two major arenas. One is clinical, and my clinical job is very similar to what I practiced in military medicine. One thing that does happen in Army medicine, military medicine, is that you are often put into leadership roles shortly after residency and fellowship training. Within a couple of years, you may be head of a clinic, much like Miriam. I was the department chief at Walter Reed 8 years after I completed my fellowship training. And, you are really forced to kind of reflect on what kind of leader you want to be. Military provides both formal training in leadership and leadership skills, and then also there's the day-to-day responsibilities that require you to kind of form your ideas about what does it mean to be a leader, what does it mean to be a head. So, at the present time, as a director, now I've come over to the NIH as the director of education and training. I'm very experienced or fortunate to have a deeply experienced administrative staff. And they manage the programs extraordinarily well, allowing me to focus more on operational and strategic issues and not necessarily the day-to-day concerns. And that's one thing I found, I think, unique about certainly being here at the NIH. So, again, I had to define what my goals were here. And in Army medicine, there's this motto of mission first, people always, which is to say that we always must keep our responsibilities and objectives front and center, but it's always with the recognition that we do this with our people. So as a leader, both in the military and now, I really genuinely feel like that my role is about the development of the people that work with and for me. And I think that this approach to organizational management was both formally trained with me, and then also I think instilled as a kind of a philosophy about how I want to work with people. So absolutely everything that I do now and how I approach people, organization has been based on what my military experience is, and that's what I've seen with other individuals who have come out of the military, whether or not under a civilian organization or a government organization like HHS. That's the type of skill set that they bring. And so, and again, I think both John and Miriam certainly share what that looks like. So, yeah. Thank you.
Thank you, Tom. Yeah, so, it's really great to sort of hear these testimonials, 10 to 15 years ahead of my time, 50-50 ops versus technical. The references to the foundational competencies and skills that were learned in the military and how much they apply to the work here at HHS. And this idea of, being able to swiftly move into leadership positions are all part of the opportunities that are availed by entering into public service with Health and Human Services or some of the other federal agencies with regard to public health. All right, so The next question, and we'll go ahead and start with Miriam on this one. What kind of mentorship or support did you receive during your transition to a medical career? And are there any resources or organizations you would like to recommend to those considering a similar path? Miriam?
Yes, thank you for that question. So when I first transitioned to the FDA, I spoke with other Air Force officers who had also transitioned to the FDA and USPHS. So they were my primary source of information. But then when I started as a medical officer within FDA, there were other PHS officers that were already there. So I relied on them when I had questions about PHS or about my division. As time went on, I began to network with other medical officers, with other PHS officers at FDA through various leadership courses or other FDA and PHS related activities. The US PHS has a physician professional advisory committee, and they offer mentorship support opportunities as well. And that's how I was introduced to a lot of my mentors who, some of them even worked at FDA with me. And the assistance that I received from these mentors was extremely valuable, especially in putting together promotion packages or just having, just general questions. FDA offers many mentoring opportunities for new employees. And in addition, there's also a specific mentoring and education program that was developed for new PHS officers who join the FDA. And I'm involved with this program. I mentored two new officers who recently started as at the FDA, just as a way of kind of giving back to those who have helped me so much through the years.
Thank you. Thank you, Tom. You're on mute, Tom.
There we go. Okay.
There we go.
You missed all my brilliant thoughts. Now I have to start over. No, what I was about to say, that this was actually a very challenging transition for me, and because there are very few people that I was close to or even knew about who had gone from Army medicine to a clinical position here at the National Institutes of Health. There were folks that had left military medicine that took up research positions and jobs, but not necessarily doing what I was doing. And actually, no one was doing education and training because there were very few folks at the NIH doing the specific role. So that was, I had to sort a lot of that out. And my the predecessor for my office actually had retired before my arrival. So I had to depend upon my direct reports and colleagues and peers to kind of assist me in understanding what the scope of my responsibilities were. Our senior executive and CEO of the Clinical Center, Major General retired Jim Gilman, had actually encouraged me to come to NIH, and that's how I found out about it in the first place. But so he was of some assistance, but again, the learning curve was a bit steep. Since I arrived at NIH, there are other folks who've actually followed me transitioning from the NIH from military to NIH, and so I've made myself available as a resource to actually help them in that sort of transition to understand how the NIH works. And once you're here, I realize that that there are a lot of resources, different type of leadership programs. The NIH actually deeply values leadership as well, and there's leadership programs and training that's available at various levels, depending on regardless of what your pay grade is, to become better leaders and just personally as well as to understand the NIH organization in general. So, yeah, thank you.
Thank you, Tom. Brilliant thoughts, sir. Thank you. Thank you. So, John.
Yeah, thanks, Jim. So I have a little bit different experience background. So I was actually in Iraq 2010 and was applying for jobs at the CDC. I knew I wanted to work at the CDC. I heard good things, what was on TV and through the website, and just that was a known organization. I wanted to be part of it, and sure enough, within a month or two of within a month of finishing Iraq, I spent about 18 months serving. Landed a position, and within 90 days coming out of Iraq, started a whole new job, new city, moved to Atlanta and everything. I'm very grateful because my leadership at the CDC was very supportive for me to be able to take time as needed to go to the VA appointments, that type of thing, which is just up the street. So just that transition from military service into the CDC for me was fairly seamless. And I'm very grateful for that because I don't think I would have had that opportunity or just that support because, my immediate supervisor, her husband was military. Another supervisor, her husband was prior military. A lot of my colleagues were military, so I felt supported. I felt at home, and so the transition was a little bit different than from my other colleagues, but it was something that I needed at that time, and it really helped transition from that military over into the civilian role. So that was a mentorship that I got, was just I think they call it co-efficacy. It's just that peer-to-peer response and just that overall support, for military veterans. Thank you.
Thank you, John. Since we're again convening here with people that are maybe considering what their next career paths involve, we spoke about being informed and being inspired. And, here we have this word that's showing up, a path. I just wanted to ask another follow-up question if one or two of the panelists, maybe all three, want to answer. Did you have a clear path to where you are now, or was it something that you sort of made up as you went a little bit? Maybe not the best phrased question, but I think you get what I'm sort of saying. So, can you tell a little bit about the predictability of your path or unpredictability?
Since I'm the old guy here, I can share a thought. I have been completely unsuccessful in predicting my path. Because I think in part of it, I had a general idea about what I was hoping to achieve, when I was in medical school. But I think a lot of things come into play with that. Family is a big thing. Changing, altering professional goals, being in the military, national security issues. I'll just kind of leave it at that. And then also serendipity, how opportunities come up that maybe took you in a direction that you weren't necessarily expecting. So, I think that one of the things that I am challenged with is understanding when I'm looking at an opportunity, and keeping my mind open to that. There's something that I hadn't previously entertained that may actually be something that I could actually flourish in. And so that's something I continue to work with, even at my point in this career. So again, to answer the question, was it predictable? No. One of the things, seminars that I oversee is one we do for our medical students who are here on a research fellowship, and we call it a process of discovery. And we bring mid and senior career investigators in to meet with the students and talk about their careers. And one of the things that is a common element is that there is no one who has had a linear path. Even Tony Fauci, who's met the students, what he was endeavoring to do early in his research career is completely different now, and he was not envisioning to become public health policy expert at all, but that's what he's become. And so, at least for myself, I decided to embrace it rather than feel like I'm kind of falling off the path, but the path keeps opening up new opportunities.
I think Tom makes some excellent points. My path was not clear at all. I envisioned, graduating medical school, residency, being a family medicine doctor, and practicing in clinic. And my first introduction to PHS was seeing another person in the Air Force base where I worked at in a PHS uniform. So I was just talking with her, hey, what do you do? What's this uniform? Are you in the Navy? Oh, no, I'm in the U.S. Public Health Service. So I learned more through her first about PHS. And then, through a friend, learned about FDA because I had no idea that physicians even worked at the FDA. I didn't even realize that was a potential path for me. So I talked to another person and learned more about what she did. And it's more about talking to others, having an open mind and realizing that, the path isn't always clear. Just be open and willing to learn more about what's out there.
I like it. I like it. That old saw about whenever you come to a fork in the road, take it. John.
Yeah, just to echo, There's no set path. You're gonna have to figure it out, and it's gonna mold and change. And as you said, fork in the road. There's gonna be multiple forks. But what I can say, coming from a military background, that path it's manageable, and we're taught the coping skills, the ability to navigate that path, and to smell the roses along the way and enjoy it. Just understand and appreciate that path. And wherever path or direction or U-turn or wherever we might go, we can do it. We're agile. We have those skills to be able to navigate that. That's what I appreciate most. Is coming from the military background. Is that path is not too big, too small, and we know that no matter what, we're going to keep moving forward. That's what I can give on that answer.
Yeah, rich conversation and insights there. All right, so Miriam, we'll start with you on this next question here. What advice would you give to individuals, whether they're currently in the military, student, veterans, or already have transitioned, who are interested in pursuing a medical career at HHS? So what advice do you have for people joining HHS in the medical career field?
Right. Yeah, great question. So my big thing is do your research, really understand what the mission of the agency or the division that you're interested in. You need to have a passion about the work that you're interested in because the work isn't always easy. I've met people along the way who come to me and they say, I really want to work at the FDA because the hours are going to be better than my clinical practice. And that's their main reason for wanting to transition. They want better work hours. And although work-life balance is important, the main reason for wanting to pursue a medical career at HHS has to be more than that. If you don't have the passion, if you don't truly love what you do, then you're really going to have a difficult time with the transition.
Thank you. Tom?
Yeah, I think Miriam nails it. You have to understand the organization you want to go get to, or perhaps at least investigate. I think that firstly, I think the question that one needs to just answer is like, what kind of career do you want at this next stage of your life? I think one thing that, again, to Paris's credit, I think she's assembled here a panel with, the three of us with very different type of careers. And I think that, whether or not it's in, field engagement with public health, whether or not it's working the FDA, working on policy, doing clinical care. I think the wonderful, and it goes back to something that John had said earlier, being in the military, you develop an amazing amount of flexibility, and I think to that, you have this ability at the end of a military career, where it's, 5, 10, 15, 30, whatever, to choose a different path. You've developed a lot of skills, a lot of credentials. And so you have this opportunity to think about what type of career you want. And so you look at that. As far as a career here in HHS, I need to speak specifically NIH because that's my view of the world, And so the other thing is to, develop a really strong CV and or resume. In fact, I have both. I think people understand, it's like a resume captures one sort of picture of you. A CV is more academic, captures a second. So I think it's useful to develop both. And think about all the things you've done in the military that can be applied in this resume and CV, and then have people look at your CV and have people look at your resume and see, is there something that you're missing? Again, going back to my own experience here, so my appointment at NH is something called, there's different type of career appointment pathways. If you're interested in a research track, that's one type of career appointment pathway. My appointment pathway is something called a staff clinician. And so staff clinicians here at NIH have a broad range of primary responsibilities. Some are deeply engaged in clinical research, others are nearly exclusively clinical. So if you're looking to come to NIH, the first thing to understand is is the type of career you want available at the NIH, and you can achieve that through networking, to making inquiries. I'm going to share my contact information, or the panel here, we're going to share our contact information. Folks can reach out to me, and I'm happy to help guide some of that discussion. And then finally, USA Jobs. I think many people are familiar with USA Jobs. It's a complicated tool, but to be understand how to use that will become useful. understanding that the USA job tools only gives you a sort of a surface view of what's going on. So yeah, thank you.
Thank you, Tom. John, over to you.
Yeah, I like to echo. I describe it as choose your own adventure, and that's for me. That's how my career has been. I pride myself being, and it's kind of a joke, but it's not. Time Magazine Person of the Year, not once but twice, but 3 times. 2004, American Soldier was cited as Time Magazine Person of the Year. 2014, the Ebola responder, and 2020, the COVID responder. And I was part of that. I was part of history, and I got to be part of that either on the Department of Defense side as a soldier, and then twice with the CDC. And so it's really, what interests you? What exciting opportunity are you interested in? As discussed, there's so many different roles, positions. There's policy, there's logistics, there's safety, security. There's what I do as far as like public health, emergency response. So again, it's choose your own adventure, and a lot of what I do in the military translates to what I do at the CDC, and vice versa. And so it's really worked hand in hand in pursuing this career. So thank you.
Thank you, John. You know, we started out with Miriam talking about passion and love what you do. You know, I'm reminded of Jerry Garcia from Ben and Jerry's Ice Cream, you know, that said, if it's not fun, why do it? So I'd like to take I think we've got a good amount of time here. I'd just like to delve a little bit into that sort of love what you do. And maybe there's a little memory or a story that one or two or three of you could share where something happened. It may have been just with one person, but it was like, that's one of those oh my gosh moments where it's like, oh my gosh, I'm just so uplifted by what happened. And I really do love what I do serving in public health with the federal government. Is there anyone that has something that sort of comes to mind where it was like, wow, I really do love this job because I'm able to do this?
I can share just a quick, it's sort of not a specific story. I think one of the things that I greatly enjoyed when I was a pediatric cardiologist in Army medicine is the fact that when I was seeing, kids with their moms and dads in the clinic, the fact that, I was wearing the same uniform uh, as their parents, and so when they were talking about challenges and issues that they were facing outside simply taking care of the kid and their sometimes complex disease, or not assignments or losing everything in a household move or whatever, I completely understood what that meant, and uh, when we were transferring kids, when parents were being transferred across the country, I understood what that meant for the healthcare, and I knew how to navigate that and help the families do that. And so that meant so that those patient relationships always meant a lot to me. I had one patient that I took care of began before she's even born. The father was an ROTC, was about to graduate from ROTC, and they recognized that the daughter had, and I'll just call her Angie. Angie, that's not her real name. Angie was diagnosed with complex heart disease in a fetal echocardiogram. And she was born right about the time he was about to come on board as an active duty second lieutenant. And so I was involved in care from that moment. And through 20 something years, helping manage her heart disease. And as it is now, because of some other complications have arisen from heart disease, I transferred here to NIH. And so she now still comes to see us here for specific problems that she is having to deal with because as a consequence of heart disease. And so those longitudinal, you don't often think about longitudinal clinical experiences in military medicine, but for me, I did. In fact, it's even continued here for me here at the NIH with this, same families. A lot of them actually are coming here because of their management of some of their complications. So that for me is fun. I I greatly enjoy taking care of kids, and I greatly enjoy, working with families. And so for me, that's where the fun comes up. So, and again, as you mentioned, you have to enjoy what you're doing.
Thanks, Tom. That's a great story. Yeah. Anyone else?
Yeah, I can jump in if that's okay.
Sure.
All right, so there we were, 2005. I was actually in ROTC. I was in a camp. It's called, at the time it was called Leadership Development something camp, LDAC, and they had an opportunity to donate blood. If you donated blood, you get a half day off. I was like, all right, I'm going to donate blood. Well, at the same time, you could donate into this stem cell registry, is the Department of Defense bone marrow registry, and they just collected a sample of blood, and off it went somewhere. Sure enough, within 6 months, I was identified as a 10 out of 10 match, which is unheard of for a terminally ill patient that had leukemia. I knew that she was female, international, and that she was terminal with leukemia. That's all I knew. And they said, John, there's a new, instead of donating bone marrow, you can actually donate stem cells. Would you be interested in being part of research with the Department of Defense? And this will, we don't know what happens after the research. We know what this does to individuals that are sick. But as a healthy individual, if we inject you with a drug called filgrastim, which stimulates stem cells, we can harvest the stem cells after 5 days and cryo it and life flight it over to that individual and see if it works. I'm like, sure. I was 21 years old, had opportunity to go to Baltimore. I brought my mom as a +1 and everything. Got to explore the city and everything. I did that for 5 days. On the 6th day, they did a 6-hour pheresis. And then it was just silence. We weren't allowed to have contact for a year or anything. And this is all done through the Department of Defense. And sure enough, after a year, I was reached out and said, John, would you like to be connected with your recipient? I'm like, she survived. Yes. And sure enough, her name is Joan. She's still alive today. She's in Canada. She got to watch her daughter graduate high school. She now has grandkids 20 years later. So, just something like that is so touching and just inspiring. And for me as an individual, that's really what I wanted to go to HHS, because the Health and Human Services is the front runner. They're leaders on what's going on a lot of the medicines, on the therapies, that type of thing. And so I didn't know where I wanted to necessarily land at HHS, but I knew I wanted to go somewhere. So that's kind of how I navigated myself to the CDC, was based on the experience with the military, and knowing that just these therapies, these type of support, that seems so futuristic, is now commonplace for medicine today. Thanks, Jim.
Thank you, John.
Yeah, it's definitely an inspiring story, John. I do want to share the experience that I had. I mean, as working at the FDA, I don't see patients on a regular basis, but as part of PHS, I do deploy. And I deployed during COVID to one of the Indian reservations out in South Dakota. And, seeing patients there, I did see patients who were pregnant. And it was great just having that FDA background. I work specifically in the area of pregnancy and lactation, but having an understanding about medication safety in pregnant and lactating women, and understanding the resources and how to get that information. I was able to provide that to some of the other providers that would come to me like, hey, I have this patient, she's pregnant, she's on this medication. Should we continue this medication? She's pregnant. So just having that background, I was able to kind of put 2 and 2 together, like my work at the FDA, being back in the clinic, and how important it is to have that information for women who are pregnant or breastfeeding.
Thank you all. Thank you. Yeah, so great stories there, inspired by them. The time element of sometimes we don't necessarily see what is going to play out, but as John said, to meet up with a survivor is really it's got to be a very heartwarming sense. All right, so let's go on to the next question. What emerging trends or opportunities are you excited about in healthcare, and how might these impact individuals pursuing a medical career. Tom, you want to take first go at that?
Yeah, my answer is short. Artificial intelligence. You know, I think this is just, I don't even understand exactly how it's going to affect things. I just know that it will. I think at every different level, you know, from the payer system to clinical decision making. You know, I attend a lot of seminars about this. And I think it's to be defined. I'm not an expert in AI. Actually, I went to a talk on AI that was about what happens underneath the hood. I was completely confused. But you know, there's going to be opportunity to make a big difference, and I think being understanding of that information and what the impacts will be extraordinarily important. So, I don't know how it's going to manifest yet, but that's what it is. I think the other thing is it's just the expanding body of research and knowledge about everything in medicine. You know, 15 years ago we were not talking about gene or widespread gene therapies, and you know, we're making diagnoses earlier, make more specific diagnoses. Uh, just to share something, so I was diagnosed with a form of leukemia, well, chronic myelogenous leukemia in 2013. Last time as a medical student, was the last time I heard about that disease because I was a pediatrician. It's a disease of adults. And at that time in 1985, the 5-year survival for CML was 50%. But, you know, in an interim, if for those who are internal medicine know, you know, there's the new class of medication which got developed in the 90s called tyrosine kinase inhibitors, which really was a silver bullet for treating CML. And with that, I was placed on it. There are now like 4 generations of tyrosine kinase inhibitors. So for myself, I'm looking for what probably is going to be a normal lifespan. And so, you know, there's a lot of diseases for which we are making these sort of extraordinary differences in outcomes. And I think, and for me, that's very exciting. And personally, I'm very happy about it, obviously. So.
Thank you, Tom, and I'm glad to hear you're doing well. So, all right, Miriam or John?
Yeah, I'd be happy to share. So as I mentioned before, I work with the Division of Pediatrics and Maternal Health, specifically on the maternal health team. And while there have been significant advances to include children in research, research on pregnant and lactating individuals has lagged behind. When I started at FDA about 11 years ago, my main responsibility was to update the pregnancy and lactation section of prescription drug labeling to the new format known as the Pregnancy and Lactation Labeling Rule, or PLLR. And while the PLLR resulted in the removal of the pregnancy letter category and replaced the letter with a written risk summary assessment, what we realized in this process is that although we reformatted the labeling, there still was a big problem. There was either little or no information regarding the use of drugs in pregnant and lactating individuals. So now through FDA's published guidances, through workshops, through our leadership in national and international endeavors, the world is finally starting to realize how important research is for pregnant and lactating individuals. And I'm really excited to see what the next 10 and 20 years brings in this specific area of research.
Thank you. John, any thoughts around this?
Yeah, it's basically a hybrid approach of what Miriam and Tom just discussed. So I think what we're going to see, or what we're seeing right now and continue to see, is just better informed patients, families, and clinicians. So there's so much real-time information. It might be too much information at times. So that's something that we got to work on, just filtering, processing. But you know, having relevant real-time information so that for more individualized treatment options for population health, that type of thing. I think we're going to continue to see that progress. And then also just access to care. I think COVID really kind of pushed that to the edge with some of the telehealth and other capabilities that we didn't quite have at the time, and just some of the laws and regulations have really loosened up to help provide that support. I know that particularly at the Veterans Affairs, they provide a lot of virtual health options, that type of thing, whether it be for behavioral health or for mentoring, for coaching, for you can even do physical therapy virtually. I myself have done that. through the VA, and just so many opportunities that we see out there that we just wouldn't otherwise take care of ourselves or access that care just because of inconvenience or inability to get there, or just some of the other challenges. So I think just access to care is something that will be continuing to emerge, and we'll continue to see improved and increase in the future. Thank you.
Yeah, no, those are great. Again, part of the reason that we're convening here is to outline a pathway, an opportunity for those that are listening in today around how they can find their spot in federal government medical service and such. So these are inspiring stories around it. It's almost clichéic in a way that, there's that question, well, where, Jim, where do you see yourself in 5 to 10 years, right? And what we're hearing is that, along that time horizon, when we're first starting out, a year or two may seem like a long way off, but, as you get further in your career, you begin to notice about how time, passes so quickly. One of my favorite quotes around this topic, attributed to a lot of different people, is that people tend to overestimate what they can get done in 1 year and underestimate what they can get done in 5 to 10 years. So, give some thought to this. Where do you see your spot in the coming years? And certainly maybe this panel and the stories and insights and the availability of these folks as resources to you may help you to chart that career path for you. We're still doing very well on time, so let's move on to the next question. And we can start with you, John. How do you balance the demands of your medical career with your personal life and family obligations? What strategies or techniques have helped you to maintain a healthy work-life balance? John?
That's a really good question. I think with the technology, it's helped tremendously. I can go back to 2009, 2010 when I was in Iraq. It was hard. All we had was Skype. You had to make sure that the other person on the other end had good connectivity. You yourself hopefully had good connectivity, that they had Skype, that type of thing. I remember having to do DSN to DSN, and you had to hop around the different DSN phones until you could actually get a local carrier to patch you through. All that's been eliminated. We kind of now we don't have to worry about that as much. So technology has been a huge plus. Just being able to FaceTime family, FaceTime friends. I think also what's so important as a emergency responder is working with other colleagues that have either responded or currently that I'm responding with. So just be able to share those experiences, much like you're in the military. Share those experiences, those hardships, the good times, that type of thing. Talk about. I share with my grandpa all the time. The best part about hanging out with your grandpa is making memories about talking about other memories. And that's what I really enjoy. So having your brothers and sisters that you serve with, not just in the military, but also for me, serving with the CDC, it's very similar circumstances. You're roughing it sometimes. You're in these austere environments, and this is the career path that I've selected and I pursue. But just some of the challenges I've experienced, I like to highlight. In 2022, it was a heck of a year in supporting Operations Allied Welcome with the Afghan refugees that came across, working their medical needs and support, whether it be a measles outbreak or potential TB outbreak, tuberculosis, or COVID. We were dealing with the Delta variant at that time. Just so many challenges with that. And then immediately rolling into being a team lead for a polio response in Tanzania, and then working the Ukraine response with WHO, and then finishing the year with working Ebola in Uganda. And how do you do that and that type of thing? Well, you can only do it for so long. So, what I like to do is only be gone. I think the ideal for me is 6 weeks to 8 weeks at a time, and then reset for a month, spend time with family, with friends, with loved ones, get your batteries recharged, and then go back out. And I learned this from the military. And that's what I find. I know what my limitations are. I'm supported by my leadership. They're fully supportive. They understand. you know, like you don't want to go out there and at max capacity. Some of this is a marathon, not a race type mindset. So just be able to find that work-life balance, taking that time off when you need it, and again, just staying connected with family. I myself never had social media. I started Facebook. My grandmother asked me, she goes, well, how the heck am I going to be able to stay in contact with you? And I'm like, oh, good point. So what I did was I started posting on Facebook and Instagram, day one, life in Liberia. And it'd just be a photo of like food or some type of experience or a painting. And I did it for 90 something days. And so they got to live and experience what I was enjoying, or the hardships or the challenges they got to see firsthand, and and see the beautiful side of some of the stuff that the news doesn't cover. And so I find just having that balance, sharing those experiences, has been really impactful, not just me as a professional, but on a personal side too. Thanks, Jim.
Thank you, John.
Yep.
Tom, Miriam?
I'm still working on it. How's that? In fact, I'm sitting here, I'm getting a bunch of text messages about a consult. So it's like, okay. I think it is something. It's for me. My strategies have continued to change. Right now, I my wife's a physician as well, and so we're constantly in this ballet of trying to balance out and support one another in our different careers. And some weeks she has bad weeks, some weeks I have bad weeks, and so I think probably if there's one lesson to be taken away, is always find a great partner in life. Who can help and understand and support you, realizing at the same time it's not all just take, but you have to give as well. And so to figure out within yourself, how are you going to support the person that you decide to spend your life with. So we're empty nesters now, so we don't have that obligation, but I do have a very demanding dog, so that's the other problem. I think in terms of strategies about, how do I maintain work-life balance? I think one of the unhealthy things I did before is I was constantly taking a lot of work home. And so, I get home at a reasonable time, perhaps, sometimes not, have dinner, then immediately decide I'm going to focus on this, that, or the other thing. Now I try to take a more deliberative approach about what do I really need to do. And one of the other things I really try to do is, even if it means stretching out my day a little bit longer, is that when I finish my day, I finish my day. When I get home, that's my time to transition. So to spend time with my wife, spend time with my demanding dog, and not try to, do something extra. Now, obviously, all of us and any physician, any medical officer has those deadlines where it does require that, where you do have to do something. But for myself, I've tried to become more deliberate about that, and again, try to minimize what I do at home that takes me away from family, even if it means sort of stretching my day out a little bit longer. So the other thing I think, which is a bane of our existences nowadays, our work email. And so I have certain strategy about how I manage my work email. And one of those things, I don't take my work phone with me on social events to avoid that sort of like, I'm just going to take a peek at my work email to see if someone sent me something at 9 p.m. on a Saturday night that I need to reply to immediately. One of the things I've learned about email is that if you send an email, people email you back. And so suddenly you're in this email conversation on a Saturday night that really doesn't need to occur. So I try to become more deliberate about that in my own habit. And I tell my folks that I work with that I will not ever email anyone after 5:30, and I won't email before 8 a.m. And I won't email over a weekend unless there's a life in the balance, and when you're on the administrative side, that never happens. And so I think just kind of my, how I manage that, and consequently, I get fewer of those emails, because I think that's one of the things that really becomes one of these distractors. And so, again, trying to focus on my wife and my life at home, and having hobbies, none of which that I'm good at, but things that provide distractions becomes important for me.
I would like to share as well. As a senior officer in PHS, as a team leader at FDA, practicing family doctor, and a wife, mother to 2 boys. I mean, you can imagine I have a lot of demands. And through the years, I'm trying to manage my time and prioritize my tasks. It's not always easy. I do keep a to-do list on my computer, and every day I'll take a look and reassess my priorities. Try to start my day at 9, try to end at 5:30. I try to end on time so that I can spend time with my family. Usually we'll eat dinner together as a family, we'll work on homework, we'll try to maintain a bedtime routine for the boys. And then on weekends, it's family time. We'll participate in activities with my boys. My older son is, he likes to run cross country, so we go to his cross country meets. My little one likes soccer. We'll go to his soccer activities. They're both Boy Scouts, so we'll do scouting activities with them. We're also a religious family. Church on Sunday is very important. My older son and I both serve in our church, so weekends are definitely reserved for family. And then I also try to take off as much leave as possible. Whenever my kids are off from school, I try to, take that time off. I never have any use or lose leave time. I try to spend as much time as I can with them. We like to travel. We go to the beach. This summer we went to Iceland, had an awesome time there. We have a beach house in Rehoboth, Delaware, so we'll go there whenever the kids are on break. And I truly believe the saying where they say you can be replaced at work, but you are irreplaceable to your family. And I really, truly believe that saying.
I think there's some real gems in there that apply to any sort of occupation. So thank you for sharing those. We have come to the end of the programmed questions here. Before we open it up to others that have questions, I want to just see if Tom or John or Miriam have any other sort of closing thoughts regarding the questions we just covered, or any sort of observations or any sort of things that they might want to adjust. Anything that you want to sort of share before we move into open questions.
Nothing right now.
Sounds good, Tom. John, anything?
Yeah, I was gonna say there's so many different career paths that we're highlighting the science ones, particularly the medical and health. But there's just, like I said, pick your own adventure, or multiple adventures. There's so many different roles and positions. I can talk on behalf of CDC. We have country offices all over the world where we support global health diplomacy and public health and different pieces with that. So countries located in Asia and Africa and Europe and Middle East, where we have offices that, from admin support to logistics to safety security to plan section. A lot of the military skill sets that you learn and you bring to the table, we have those type of roles. And so I think it's good that we're highlighting the sciences here, but there's also so much additional broad positions that we can help navigate you towards or think about as you transition. That's all I had.
Excellent point. Excellent point. Miriam, go ahead.
Yeah, and same thing with the FDA. I mean, we have offices throughout the country as well. It's not just physicians, there's pharmacists, there's chemists, there's microbiologists, so many different opportunities, so many different areas. If you're interested in FDA, so I'm definitely happy to speak with anybody off line if they have any interest in learning more about FDA.
Thank you for that. Thank you. All right. Well, now is time for questions from our audience. Paris, do you have any that you want to let me know about, and we can have the panel respond? You can go ahead and type your questions into the Q&A at the bottom of the Zoom menu.
Okay, we just opened up the Q&A, so let's give it a minute for the questions to come in.
So we have a question. Can anyone speak on the resume and overall application process? I know that we spoke about using the USA Jobs. We probably don't want to get too down into that, but in terms of your resume, military resume, and making application, any suggestions, Tom or Miriam or John, on that?
Yeah, I can help with that.
Oh,
Oh, go ahead,
Go ahead,
John.
John. No, go ahead. please.
With the health scientist route 601, you can actually build in your resume in USA Jobs, and I think that's the recommended way, just so that it'll walk you through like all the different areas that you need to cover, so that you don't leave anything out. So I would suggest building it within USA Jobs and using their resume template. And I can speak for myself. No. I applied to a lot of different positions, and keep trying. It's difficult to navigate. It's not easy. It's not a science. If you're a science-minded person, it can be challenging. So I would say apply. I think I applied to 100 different positions at one point. So that was for me when I was going through the different application processes. So it might be different now. This is about 15 years ago, but just keep trying.
Yeah, for physician clinical jobs here at the NIH, we'll certainly just accept people's CVs opposed to the one built into USA Jobs, but then that's acceptable too. We've had applicants to our positions, both types. I think that probably the most important thing is to ensure that it's complete and accurate, which means, no typos. On your publications, if you have any publications, posters, presentations, to make sure that using standard formats and make sure they're complete. We now have, people are now including DOIs and hyperlinks to articles, and depending on what kind of position you're looking for, that becomes that really is additive to your CV as well. So again, I think in general, I think the most important thing is just make sure it's complete and accurate. And again, think about your different military roles and responsibilities. One of the things that a lot of folks, then, especially the subspecialists or those who served in military, the medical centers, lots of committee work is done, especially in research administration, serving up IRBs. Make sure all that work is captured as well.
Yeah, thank you. A question here about someone having 2 masters in data analytics. I'm 60. I'm thinking that I'm 60 years old. Do I have an opportunity? Absolutely. Absolutely. There's all kinds of opportunities for data analytics all the way up through artificial intelligence. I encourage you to go out to USA Jobs, do a search for data analytics. If you're 60 and willing to serve, we're willing to take you on. So another one here, I'm interested in going back to school for anesthesiologist assistants. I was wondering which agencies in HHS would have anesthesiologists. Any response from the panel?
Well, I think if you're looking for a clinical job, I think you're talking about either HHS, or excuse me, the NIH. We're here at the clinical center, which is a hospital for the intro research program for the NIH. And so we do have a lot of anesthesiology, or anesthesiologists and CNRAs who are supporting our programs here. So.
Even at FDA, if you're interested in anesthesiology drugs, we have a specific division that looks at new drugs that are coming out for anesthesiology. So if you do have an interest in not practicing medicine, but working specifically on the medication side of things, FDA is also an option.
Yeah, and also related to that, I know that, just using a nurse as an example, a nurse very well could get involved in grant applications. There are a lot of grants that come through. So even though you may not necessarily want to move in that clinician, your expertise in an area can be applied certainly through grants or other research, and contracts and things like that. So I don't think this is so much a question, but an author, the Centers for Medicaid and Medicare Services, multiple opportunities for veterans, ton of data over here, tremendous amount of medical contract work. We just talked about that. Contracting officer representatives, contracting officers, the submitters. I'm military retired environmental engineer and scientist. So lots of work there at the Centers of Medicaid and Medicare Services based out of Baltimore, Maryland. And I think that really applies to all the different agencies. Are there any opportunities open to nurses? Anyone want to take that one?
Well, again, here at the NIH, we're always looking for great nurses. And in addition, nurses both who are interested in clinical nursing, but also nursing research, nursing administration. So the clinical center is a 200-bed hospital here that most people don't know about. That's on the Bethesda campus of the NIH. And so with a full range of services. And so, yes, clinical nurses are highly sought after here. So.
Yeah, and FDA as well. There are opportunities if somebody's not interested in practicing medicine. We do have nurses that I have worked with within my division, either as a former team leader or people who are project managers take on that role and were previously nurses.
All right. I have a question here. Veterans, students aspiring to go to medical school, need a mentorship and guidance. Any help in that regard? The submitter says they're a graduate student. So any suggestions for mentorship or guidance that you might offer?
I mean, I'm always willing to speak with medical students. I have plenty that reach out. Through my work at the clinic, I meet lots of undergraduate students who are pursuing careers in medicine. So I'm always happy to reach out to people. If people are specifically interested in the public health service, we do have a group that is specifically for recruitment. So that's also an option if there's an interest in the commission corps.
Yeah, like Miriam, I'm happy to serve as a resource as well. I work with a lot of postbacks, a lot of folks who graduated college, even undergraduates, and previously worked as an interviewer for Uniform Service University. So I have some experience in understanding how that process works as well. So I'm happy to provide at least some thoughts and guidance on that as well. So.
Thank you. I have a question specifically for John. Was it difficult when you were overseas to help find a job with the CDC, or did you have a mentor help you?
So you guys said send us out to our family, and my family is participating, so I'm very happy for that. That's my brother, Ferris Sandin. It was a little challenging. I could say I remember calling HR and checking on something, and they're like, "What is that noise?" And I'm like, "Oh, we have incoming fire. We're being attacked." They thought it was a movie. They asked me to turn down the TV. I'm like, "All right, well, it'll go away after a little bit." So that was a little nerve-wracking, when you're trying to prepare for interviews and that type of thing. But all in all, no, it worked out. And I think there's another question in here as well as do you feel like the military gives you a leg up or additional edge? And I can't speak for everyone, and it depends on what the position is and everything. But for me, it definitely presented an opportunity to really showcase the skills that I have, in addition to the technical, but also the program side. So for me, it provided an opportunity, and I think it shined as far as my CV and resume compared to other applicants at the time.
I have a question here about healthcare administration. Maybe John, do you want to talk a little bit about healthcare administration from what you've seen at the NIH?
From the CDC, or do you want to talk?
Yeah, Tom or John, either one of you.
Tom, I'll
healthcare administration.
Yeah, so I mean, here, many of our administrators are in either the 343 series or 301 series, and there are The NIH actually issues a job announcement annually for general cert for both, I think, 343s and 301s. And so there's always those applications. In addition, there's specific jobs that get posted well on USA Jobs as well. So.
Yeah, we're similar at CDC. A lot of our health management type positions are those 301 series. And if anyone's curious what that is, all of our positions have a nomenclature. So in the discussions that we're having here is a 601 and 602 series, which 601 is a health scientist, 602 is the medical doctor series. 301 is it's more of the management administrative side. And those are kind of a little bit universal. You'll see those not just within health and human services, but spread out throughout the U.S. government. So there are opportunities there, maybe more so in some of the other HHS, CDC, we do have some 301, but maybe not necessarily in the health administration side.
Thank you. Yeah. So a question here, recommendation and job series search, U.S. jobs for those prior enlisted, not seeking MD or PhD positions. Populates via search at GS13. I'm working on MPH. Not sure what grade translate to. So, as a prior enlisted member myself, coming off the flight line with the Air Force and some work I did in training and development, take a look at some of the jobs that are maybe program management analyst or management analyst, GS12s, 13s, sort of makes sense there. A lot of jobs actually in the federal service do not have an educational requirement. So if you look down further in USA Jobs, you'll sort of see that, sometimes it doesn't have an educational requirement. Just think back to, those skills that we talked about earlier, everything from time management to working in ambiguous situations. Those are all fundamental attributes that can apply to lots of different jobs. So in USA Jobs, it is a little sometimes challenging, but you can search by geographic location, you can search by different agencies, you can search by occupations. Encourage you to just take a broader look at all of the different jobs that are available. You might not think that there are truck drivers or police or security at HHS, but there really there are, and there's all kinds of different jobs that are available in different parts of the country and across the globe. So,
Jim, I just wanted to add to that. There's also a lot of pathways into the federal sector. So at CDC we have a lot of fellowship positions. So it's a term role, 1, 2, 3 years. I don't know if Miriam or Tom, if you guys can talk to EIS if you've done that. But there's a lot of different pathways. You don't come directly in as a federal employee, but it's a pathway to become a federal employee. And so I know that that's another route to pursue as well.
I don't exist, but I'd have to turn that question over to HR specialist like Jim. So.
Yeah, we do have fellowship opportunities at FDA as well. And a lot of the people that end up coming in as permanent employees have started their careers as either ORISE fellows or other fellowship programs through FDA. So that definitely is another opportunity.
Yeah. So we have, I'm currently active duty, retiring soon. My resume does not speak to my time in the military service so much. How can I capture this? I'm paraphrasing here, but support the military's career skills programs. I can tell you what I sort of did is I knew what was in my resume, but I sort of realized that maybe that's not going to really translate directly. So what I did is I started looking at jobs in USA Jobs that I'd be interested in and, sort of get a sense of how it's stated in there. And then, think about what I did and sort of see if I could match that up. So maybe instead of trying to put your resume into the USA jobs is look at what those jobs and look at what they're looking for, and then think back to your military experience and, come up with some examples of how you can sort of share that. But I'm certainly available to talk with anyone who may want to follow up on that. All right, so great presentation, medical opportunities information. As a transitioning AD Army family nurse practitioner, what are some of the opportunities available as a civilian practitioner?
I'm happy to actually answer that, but I want to go back to one thing you were talking about real quickly about resumes. And one of the things that I have found with a lot of folks transitioning from the military to the civilian sector, where not it's another federal job or civilian itself, is the title that we have. And I think it's important to be able to take whatever military title and try to figure out what is the equivalent for the civilian title, perhaps in parentheses afterwards. For example, like I was a director for health operations. That's really like but I sat on the board, so that's like a vice president equivalent position. To be a senior enlisted leader, maybe like the chief management officer. So think about your positions, and then think, the specific title you might have had as a military officer or enlisted, but think about what the civilian equivalent, and that's not inflating anything. It's just trying to develop some equivalency, because the language we speak in the military may not be understood by those in the civilian world. So that's something to think about. Going back to this question, first family nurse practitioner, I just want to say at the NIH, we have a lot of advanced practice providers, both PAs and nurse practitioners, who do a lot in terms of supporting different type of clinical research protocols. So there are quite a few MP positions, opportunities that do exist here at the clinical center. They're very challenging because unlike general practice, you're working with individuals who are here on clinical trials at the NIH who have some rare or refractory disease. So it's oftentimes a very steep clinical learning curve, but it's actually extraordinarily refreshing and both challenging, but also it's a lot of fun. So.
Yeah, same thing at FDA. There are also people who are nurse practitioners, physician assistants who do have positions at FDA. And within my own division, there's a physician assistant that works as one of our project managers. So there definitely is a role.
This next question, what would you all say having military experience help build competitive advantage over other applicants? I'll sort of answer that and want to defer to my colleagues on the panel. What I've noticed in working in federal civilian service is with the military folks, there really seems to be this keen edge or insight into getting things done. Really understanding what is the goal and pursuing that and bringing it to completion. So, I think a good tip for, resume writing is, what did you do? How did you do it? And what was the result? And how did you sort of follow through on that? So I think in examples in the resume, just think about what were those things that you actually got done that were of a challenge and sort of put that around the different occupational settings that may have. But John or Miriam, Tom, anything else to add on that one about translating military experience to competitive advantage?
I agree. I like to underline exactly what you just said. The thing is, you have to translate that language and experience into a way that someone who's not familiar with the military world can understand. So you have to kind of translate your experience into their world and not assume they understand what you're talking about. I was the executive officer of a battalion size unit. That means nothing to anybody. But to say that you were the chief operating officer for 700 soldiers or Marines or whatever, to be able to describe that becomes extraordinarily important. So.
The translation is absolutely critically important. The military and HHS to some degree, the use of acronyms that we sometimes forget what the real thing is. I was spent some time as an Air Force recruiter, and that was a big challenge, was to be able to translate what the military does into terms that we are all sort of familiar with. I'll use a somewhat dated example along these lines, but use it for things that are more relevant to your job inquiries. And that was talking about one of the benefits we have with the BX, you know, those in the Air Force or those in the Army, known as the PX, right? The base exchange. And what we would say is, well, you know, it's sort of the base exchange is like a J.C. Penney with Kmart prices, was sort of and it's still a little silly and it's a little bit dated, but it's the idea of taking what you're doing and translating it into something that makes sense to the hiring manager that may have not, you know, served in the military, but now is serving at, you know, the CDC or NIH or et cetera. So translation is critically important, and it's not a misrepresentation. It's really just trying to convey meaning.
Yeah, Jim, I just wanted
Right.
to add, there's also a congressionally mandated program out there. It's called the Army Transition Assistance Program, TAP, TAP. And I know there's other services out there, so they might have other as well, as I can speak on behalf of Army, but it's exactly to that question. It helps translate those skills, that background and experience into you know, that resume builder, the profile, that type of thing. So huge advocate of that. I came off of active duty and had and I'm glad I went through it so I could share these experiences. So I went through the program. It's either classes or online modules, that type of thing. And they have programs available for reservists, for individuals transitioning from active duty, retirees, that type of thing. So again, it's Army Transition Assistance Program, TAP, is one that's also recommended.
Yeah, thank you. Thank you. So here we have
Sure.
a question around the 602 path and undergraduate internships, a former Navy corpsman, VA benefits, attempting to enter federal medical service. So I think the gist of the question is around orthopedic surgery. How does someone get sort of started in federal service on a path, maybe pursuing that type of service? Any response there?
Yeah, I guess there are a couple of different parts to this question. So in terms of the undergraduate internship opportunities, there are opportunities at FDA for summer internship programs. So we've had several students that will come in, spend a couple of weeks or maybe 1 or 2 months over the summer, and they work specifically with one of the divisions at FDA. I think the other part of the question is, it looks like this person is interested in orthopedic surgery, and is that something that's accepted through USPHS? And PHS accepts a wide variety of different specialties. And I believe orthopedic surgery is on the list of different types of positions that they'll accept. So I think that's another part of their question. So if they have interest in, you know, becoming a physician through PHS, definitely reach out to me. I'd be happy to put you in contact with the right group of people that are specifically involved with recruitment that can provide more information about a medical career through PHS.
Thank you, Marianne. Does anyone on the panel have any information around the National Health Service Corps?
I do not, Jim. I saw that question. I don't. I'll defer to Tom or Marianne if you guys do.
I don't have any experience or information I could share. So.
Yeah, no, unfortunately, I don't either.
Okay. Certainly can follow up with me. I can do a little bit of research on that and we'll get back to you. All right. Trying to get into clinical research hasn't been possible. Some level of, don't have the level of experience. What can I do to get it? And I'm paraphrasing some of it. What can I do to get an entry-level job into the field of clinical research?
Yeah, I think that's you know, a common conundrum. You can't get a job because you don't have experience. You can't have experience because you can't get a job, right? Unfortunately, I think that it's one of these things where you keep applying, you know. And the thing is, the job market's dynamic, both at, you know, at the you know, FDA, CDC, NIH. There's always jobs that are kind of popping up. but it's a matter of just continually, looking and applying. The other thing is always, and another thing too is kind of, I would suggest is like broaden the view about what that means to get an entry-level job in clinical research, and also look at industry in your local areas or the other things, local hospitals. So anything that can allow you to sort of build your CV, I think is the way to get started. But the challenge you speak to is real, but I think it's a matter of things. Just if that's what if you want to do, then stay committed to it, and again have a kind of a broad view of what that means and what kind of positions you can get into that.
Absolutely. Yeah. So there's a call out here for careers at CMS. The link is there. Go ahead, John.
I was just, I like the ingenuity on the CMS side. I think, I don't know if they're better or not, but it's definitely, seizing the opportunity, piggybacking on what we're doing here. But hey, why not? We're all working for the same team, so I appreciate it.
Absolutely. So a question here, BS in health administration, other jobs for administrative assistants could occupy the degree and military experience. I think that sort of goes back to my comments around program management or management analyst. Those are the sort of the titles of job categories that are broadly defined within supporting either various programs or activities. So take a look at management analyst and program analyst for those. I've been out of the military 3 years now and disabled 10.10 experience field, different degrees, not having much luck. Are there any higher opportunities outside of what is shown on USA Jobs? There are opportunities. A lot of them do go through USA Jobs. You may want to look for some of those other hiring flexibilities. You can, if you do a search for the Office of Personnel Management and various hiring authorities, as the sort of the technical term, you'll see a lot of different ways in which you can enter in. The idea of not having much luck, it does take a while. I will say that it does take a while. So, the first thing in applying for a job in sort of a general foundational aspect is, the resume is to get the interview is to get to the job. So take a look at those jobs that are in USA Jobs that you might have an interest in, and then continue to try to translate those things that you did as a 10-point veteran into those jobs. All right. Currently undergrad for ASU and currently serving, in love with medicine. Seen hospitals hiring paramedics, EMTs. Unsure what would still be early in the medical career field. So I think it's a question around what are some of those more entry level things that can get into the medical career field.
One thing I think it's valuable about these early jobs is just learning the language. My first job, I was working in a chicken restaurant, but my second job, I was an EKG technician in college. And actually, I think perhaps that's where my fondness for cardiology came from. But to be in that environment, to understand, the word, like, what does stat mean? To understand the language and environment, I think that does become important, and that sort of lays a foundation. So as you develop other type of experiences or you advance your schooling, it's something that you can sort of build upon. So yeah, I think all these things do become are valuable experiences, and so. I do know a lot of undergraduate campuses have like EMT experiences that that can be provided. So I would, if that's something you're interested, I would encourage you to continue with that.
I think so.
Yeah, definitely. I would echo what Tom just said. I think it's important if you have the opportunity to go ahead and seize that I work with scribes at the Arlington Free Clinic all the time, and a lot of them are, undergraduates or recently graduated from college. And just that experience that they're getting in the clinic, just learning the language is going to really serve them well. Medical school has gotten very competitive from when I went. And all these different experiences, I think, are what it's going to help you get into medical school. So definitely encourage it.
Yeah, I think so. I think that sort of keep in mind the basic ideas of what the federal government does, right? The federal government takes in tax dollars and puts out programs and services, oftentimes in the way of grants. So there are a lot of different types of grants that are, put out. Someone needs to review those grants. Someone needs to frame them. So grant specialist is a good way in which to take maybe some of the medical career field that you might have and turn that into a job that's sort of related. The same thing with the government buys a lot of things, so there's the whole procurement aspect. And then there's lots that's done with contracts. So just sort of take a step back maybe and think about what are the basic things that the government does in support of the medical career field, and you come in through those ways. Recent completed 68W training, and I'm currently an undergraduate student pursuing a career in medicine, ROTC. Now preparing myself. I'm looking into the IPAP program. Is that something you would recommend? I'm not familiar with IPA.
Oh, that's the
IP.
inter-service PA program, correct, if I recall?
Okay.
Yeah.
Go ahead, Tom.
Yes. Yeah, Tom, you got it.
John.
Yeah, so I guess it's like, would I recommend, if you want to be a PA, yeah, I strongly recommend it. You get great training in that program. And I think that this is a great career opportunity to be a PA, advanced nurse practitioner. I think all these things are great ways to practice medicine. So as far as like anything to prepare yourself for the application process, I'm not everything. I'm not quite sure. Obviously do well in your studies. I think part of it is going to you have to submit letters of recommendation, and I think so. Developing a network, reaching out to mentors, and so that they are deeply familiar with your own ambitions and passions and can see your performance will become extraordinarily important. I think under letters of recommendation, I think are probably overlooked in terms of importance by applicants, but when you're looking to bring people on board, we look at these with a critical eye, because it does give us insight into what type of person you are. So
yeah. So here's a question around data analytics, data scientist. All the operating and staff divisions across HHS, all of the different organizations, all need data analysts and data scientists. Do a keyword search for either one of those. You'll find an abundance of opportunities around data. There's even a special core that is being established around AI. So really need that kind of help. Just wanted to say hi to Dr. Berlow. Okay.
Oh,
You got a hi there.
hey, Paul, it's good to see you. Hope you're doing well. Yeah, so yeah, Paul, a superb nurse officer. It's good to see you. I hope you're doing well.
Good deal.
Yeah, and go Army. All right.
Yeah. Bachelor's in healthcare administration, want to work CDC, FDA. Absolutely. John or Miriam, you want to speak a little bit about CDC or FDA?
Yeah, I think with the Bachelor's of Health Administration, the 301 series that we discussed earlier is definitely a way into that. And then from there, you can, if interested, go on to get an MPH, Master's of Public Health, or another master's. And if interested, go on to the public health, the public health analysts, which is PHA, which is called the 685 series. And those are typically the deputy positions that throughout the agency.
All right, thank you. Here we have 100% disabled veteran, biological data scientist applying to jobs, not hearing back. Encouraged to take a look at that translation that we were sort of talking about. You may want to look at a number of different jobs of what you'd be interested. You can copy the text from what their requirements are and then sort of blend them together to find out what are the current themes, and then look at your resume to make sure that they're matched up. But I'm available if you want to contact me. I'm not a recruiter, but I went through the process myself and understand a little bit how it goes. But I think it's really just that matchup of government's looking for this, and you're clearly stating that you have what's being looked for there. All right.
Hey, Jim, I think we're at the top of the hour for the last few minutes to close us out.
All right. We'll capture these. Maybe there'll be some provision to answer. So Paris, I'll turn it back to you. But before I do, I just want to thank the panel for a wonderful, insightful conversation. I know I learned a lot, and I appreciate everyone that has taken the time out to find out about careers at HHS. So thank you for the opportunity to moderate here, and thank you to the panel for your participation. Paris, I'll turn it back to you to close out.
Okay, well, thank you, Jim, and thank you to our panelists for sharing your insights today. Before we wrap up, I wanted to, next slide, please. Thank you. Before we wrap up, I wanted to spotlight some essential resources for veterans pursuing careers in the federal government. First, the Office of Personnel Management offers a comprehensive guide on special hiring authorities for veterans, including options like veterans recruitment appointment, which can open doors to federal roles. For those considering direct hire authority, a process that can accelerate hiring in critical roles like medical officers. You'll find more details on the OPM website for that as well. And finally, I encourage you to look into the U.S. Public Health Service Commission Corps. This is a unique program, and it provides opportunities for health professionals to serve in impactful roles across federal agencies. And I think probably the most valuable resource you're going to get today is that our esteemed panelists have offered to give their contact information to anybody who has any questions, and they said that they would be happy to help. So when we do send out our follow-up email with the link to the recording and the PDF document of this presentation, we will include their contact information as well. And I just ask that you respect their time when you do reach out. These resources are designed to help support you on your career journey, and I hope that you find them valuable. Next slide, please. Don't forget to connect with us on LinkedIn at HHS Careers. There we post highlights from today's event. We'll have updates on future webinars and resources to help you navigate the application process at HHS. Following us on LinkedIn is an excellent way to stay informed about new opportunities and developments across the department. I just want to add that every Friday we post all our hot jobs on there. So if you're seeing it posted on LinkedIn as a hot job, it's definitely something that we're hiring for. Next slide. And be sure to visit HHS Careers to catch up on highlights from today's panel event. As I said, this recording will be posted on our HHS Careers site, along with previous webinars we've done, such as how to navigate the federal hiring process as a veteran. So I encourage you to check that out. And let's see. So if you check out our careers page, we also keep all of our upcoming webinars posted there. So I encourage you to visit us. And we're here to support you and your journey towards a fulfilling career with us. And last slide. With that, here's the contact information of the Veteran Employment Program Office. If you have questions, please reach out to us at vets@hhs.gov. We kindly ask that you avoid sending resumes or sensitive HR-related inquiries. We appreciate your patience as we work to respond to all your questions promptly. I'd also like to extend my gratitude to my HHS colleagues, our moderator, Jim, and our fantastic panelists for their insights today. As a final note, please take a moment to complete the survey at the end of this presentation. Your feedback is invaluable, and as we continue to develop programs to support veterans, military spouses, and current HHS employees. We hope everyone enjoyed a meaningful Veterans Day this past Monday, and we look forward to seeing you all at future HHS Careers events. Thank you.
Thank you.
Produced by the U.S. Department of Health and Human Services.